Kaopectate suspension, in its final dose form, is used to treat occasional upset stomach, heartburn, and nausea. It is also effective in treating diarrhea and can help prevent travelers' diarrhea. This medication works by slowing the growth of bacteria that may be causing the diarrhea. However, it is important to note that kaopectate suspension should not be used to self-treat diarrhea if you also have a fever or blood/mucus in the stools, as these could be signs of a serious health condition. It is important to consult your doctor promptly for proper evaluation and treatment if you have these symptoms. Kaopectate suspension is used under a doctor's direction with other medication to treat stomach ulcers caused by a certain bacteria, Helicobacter pylori. It is not recommended to use this medication to self-treat ulcers. Bismuth subsalicylate, which is a salicylate, is the active ingredient in kaopectate suspension. Salicylates can cause serious bleeding problems when used alone in patients with ulcers. It is important to check the ingredients on the label, even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. The recommended daily dosage and optimal timing for taking kaopectate suspension should be discussed with your healthcare provider. To take kaopectate suspension, final dose form, you should take it by mouth as needed, according to the product package or your doctor's instructions. The dosage depends on your age, medical condition, and how you respond to the treatment. It's important not to take more than directed or to take it more often than recommended for your age. If you are using the chewable tablets, make sure to chew each tablet well and swallow. If you are using the liquid form, shake the bottle well before each dose and measure the dose carefully using a special measuring device/cup. It's important to talk with your doctor or pharmacist about how to schedule your medications to prevent any interaction with other medications you may be taking. If you are directed to use this medication daily, make sure to use it regularly to get the most benefit from it. Try to take it at the same times each day to help you remember. If your condition lasts or gets worse, make sure to inform your doctor. And if you are taking this medication for diarrhea, let your doctor know if your diarrhea lasts more than 2 days. The most common side effects of kaopectate suspension are darkening of the stools and/or tongue, which are harmless and will disappear when you stop the medication. If your doctor has directed you to use this medication, they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. If you experience vomiting/diarrhea that doesn't stop, it may result in dehydration. Contact your doctor promptly if you notice any symptoms of dehydration, such as unusual decreased urination, dry mouth/thirst, fast heartbeat, or dizziness/lightheadedness. Tell your doctor right away if you have any serious side effects, including ringing ears or hearing loss. This medication may rarely cause serious bleeding from the stomach or intestines. If you notice any serious side effects, such as stomach/abdominal pain that doesn't go away, vomit that looks like coffee grounds, or black/tarry/bloody stools, stop taking the medication and consult your doctor or pharmacist right away. A very serious allergic reaction to this medication is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. If you experience any side effects, you may report them to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before taking kaopectate suspension, final dose form, it's important to talk to your doctor or pharmacist if you have any allergies to bismuth subsalicylate, aspirin, salicylates, NSAIDs, or any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other problems, so it's important to discuss this with your pharmacist. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have bleeding problems, gout, or if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine. If you are planning to have surgery, make sure to inform your doctors or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Since this medication contains an aspirin-like product, salicylate, it's important to note that children and teenagers younger than 18 years should not take this product if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, taking aspirin or aspirin-like products increases the risk of Reye's syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as this medication may harm an unborn baby and cause problems with normal labor and delivery. It is generally not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It is not recommended to use this medication after 30 weeks of pregnancy, so it's important to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, but similar drugs have been known to have undesirable effects on a nursing infant. It's important to consult with your doctor before breastfeeding if you are using this medication. It's important to be aware of any potential drug interactions that could affect how kaopectate suspension works or increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with kaopectate suspension are valproic acid, carbonic anhydrase inhibitors, such as acetazolamide, corticosteroids, such as prednisone, dichlorphenamide, and methotrexate. This medication may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs like clopidogrel, blood thinners like dabigatran/enoxaparin/warfarin, among others. Be sure to check all prescription and non-prescription medicine labels carefully, as many contain pain relievers/fever reducers, NSAIDs such as aspirin, ibuprofen, or naproxen, that are similar to kaopectate suspension and, if taken together, may increase your risk for side effects. Low-dose aspirin should be continued if prescribed by your doctor for specific medical reasons such as heart attack or stroke prevention, usually 81 to 162 mg a day. Consult your doctor or pharmacist for more details. Lastly, kaopectate suspension may interfere with certain medical/lab tests, such as X-rays of the intestines using contrast dye, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much kaopectate suspension and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, you can call a provincial poison control center. Symptoms of overdose may include ringing in the ears and hearing loss. Always take the recommended dosage of kaopectate suspension and seek medical help if you experience any severe symptoms. As always, be sure to keep this medication out of reach of children. If your doctor prescribes kaopectate suspension for you, do not share it with others. If you are taking kaopectate suspension for diarrhea, make sure to drink plenty of water to decrease the risk of dehydration. It's best to consult your doctor or pharmacist for more details. Remember to follow the recommended daily dosage and take it at the optimal timing for the best results. If you forget to take a dose of kaopectate suspension, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store kaopectate suspension at room temperature, away from light and moisture. It's important not to freeze it or store it in the bathroom. And of course, always keep medications out of reach of children and pets. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.